Hi guys, today I'm gonna show you the course of the ulnar nerve, your upper limb. I'm gonna use this drawing and gonna use this upper limb, and I'm gonna focus on the root values, focus on the vulnerable sites and the course, and which muscles and which part of the skin has been supplied by the ulnar nerve. So in my previous videos, I showed you how the brachial plexus has been formed. If you look at here, we have the M-shaped nerve, which is forming three nerves, three main branches of the brachial plexus. Laterally, we have musculocutaneous. In the medial, you can see the median nerve, and the more medial one is the ulnar nerve. So ulnar nerve is the more medial part of this M-shaped nerve. If you go back, you can see that how ulnar nerve is formed by the medial cord, and if you go more back, you can see it's continuation of the inferior trunk and the root values C8 and T1. So the C8 and T1 spinal nerves come together, make the inferior or lower trunk, and it continues as the lateral medial cord, and it continues as the ulnar nerve, which is more medial. So the root values of the ulnar nerve are C8 and T1 spinal nerves. Now I'm going to focus on the course of the ulnar nerve. If you look at here, this is the upper limb, here is the axilla or armpit. This is the axillary artery. You can, if you look at here we have the M-shaped nerve. So laterally you can see the musculocutaneous. In the middle here we have the median nerve, and the more medial one is the ulnar nerve. So as you see here in the upper medial side of the arm, you can see the ulnar nerve is on the medial side of the brachial artery. When it goes down, it's leaving the brachial artery and it passes it goes down and taking the course on this muscle, which is the medial head of the triceps brachii. So this is the long head, this is the medial head. And then if you look at here, it passes behind the medial epicondyle of the humerus or funny bone. Here it is more superficial, it is directly under the skin, and then it becomes deep, passes between these two muscles. This is the flexor carpi ulnaris, and you can see this is the flexor digitorum profundus, and this yellow line is the ulnar nerve, which is passing between these two muscles and supplying these two muscles. At the wrist, you can see it's lateral to the pisiform, lateral to the hook of the hamate, and it crosses the flexor retinaculum. This white color connective tissue is the flexor retinaculum, and it gives a superficial branch and deep branch. In the hand, it supplies most of the hand muscles except the thinner and two lateral lumbricals that are supplied by the median nerve. Rest of the muscles are supplied by the ulnar nerve. So ulnar nerve is not supplying any muscle at the arm. It is just supplying 2 or 1.5 muscles in your anterior arm, forearm. Anterior forearm, we have flexor carpi ulnaris and ulnar half of the flexor digitorum profundus. It also supplying all muscles of the hand except thinner and 2 lateral lumbricals. I mean, it's supplying the hypothenar muscles and two medial lumbricals, and it also supplying all interosseous muscles. You can see we have 4 dorsal interosseous muscle and 3 palmar interosseous, and finally it supplies this muscle at ductal pollicis. So it also supplying the skin of the 1.5 medial fingers from the palmar surface and from the dorsal surface. It also supplying the skin related to the 1.5 corresponding part of the 1.5 fingers from both features, for both views. So as a quick wrap up, so it's supplying 1.5 muscles of the forearm, anterior forearm muscles, all muscles of the hand except the thinner and 2 lumbricals, supplying the skin of the 1.5 medial fingers from the palmar and dorsal surfaces, both, and the vulnerable sides. So as I mentioned before, when it passes behind the funnible medial epicondyle, it becomes more superficial. If you hit it, you can feel some tingling. So it's more vulnerable to be damaged here. And it also more vulnerable here to be damaged when it passes just lateral to the hook of the hamate. Yes, this is the ulnar nerve, the root values, the courses, and it also supplies some muscles and the skin and some vulnerable sites. Thank you so much.